have access to healthy foods, that they have access to active living, and that we work on policies that are really going to meet the communities where they are.
So, specifically about food insecurity, which is an issue that we're working on together now. Why did American Heart Association make the decision that this was where they wanted to make an impact in Dallas, specifically on food insecurity?
Well, we've realized that there's a great disparity in terms of access to healthy foods from southern Dallas and northern Dallas, and in underserved populations and communities of color. It's just a huge disparity in terms of having access to healthy foods. There have been a tremendous amount of work by numerous organizations that have identified the same problem. What we are really focused on is the implementation phase of all the great work that's being done in Dallas. One thing that the Heart Association has been really fantastic at is going in and passing policies, as you say. But then we go into the communities, we get the policy passed, and then we're on to the next. And what we've realized is that implementation and evaluation of the policies and becoming part of the communities that are really the most vulnerable in terms of these policies are where we have to focus, not only to come in and pass these policies, but to become a part of the community so that we can identify, what is next and what's going to be best to get to the point where we can say that no matter where you live in Dallas, you can live a healthy lifestyle, and you can have access to healthy foods, and you can have access to active living and complete streets and safe routes to schools. So it's not just about the policy itself. It's about working within and becoming a part of the communities where we are working to really have the greatest impact. And then evaluating. So looking at the data that comes about from all the great work that's being done around Dallas, so that we can identify gaps. We can disseminate that information to really provide the best approaches to help fill those gaps. And sort of that's where we have realized that community impact and collective impact within these communities is going to be crucial, along with the policy. So, we have model policies for pretty much everything that we do, from systems of care to active living to healthy eating, and we can go in and write the policies that will work. But it's in tandem with investing in the community and going and listening to the communities to find out sort of what is needed and to fill those gaps. So
when we talk about the organizations who are already kind of engaged in different parts of addressing food insecurity, and even in our conversations before we got started, we talked about UNT Dallas or Toyota or City Square, whoever it might be. But another big important part for an organization like American Heart Association is the philanthropic community, who also sees the need. So can you talk about kind of areas where you've seen the philanthropic community see that this is an area they want to get engaged in?
Well, when you have data that shows outcome, right? I don't raise money for the Heart Association. I work on the policy side, but I'm a big part of ensuring, because it all goes hand in hand. So it's that collective impact. So when we're doing good work in the community and we can show our donors sort of what that work looks like, and we're showing outcomes. So when they give monies in Dallas, they're seeing this work being done. Folks aren't going to give money. And I'm not a development person, but I mean, I this is just my personal.
But we're thankful for them.
Absolutely,
for sure,
extremely. It doesn't go without the donors, obviously, but to be able to show the impact that we're doing through our policy work, through our collective impact, through our community impact efforts. it makes a big difference so that we can sort of not only bring and affect the underserved communities, but also to bring in those philanthropic interest and donors that can help be a part of it so that we bring Dallas together as a whole in these efforts.
This is Deconstructing Dallas. We got DD with Deconstructing Dallas. We got DD with Doug Dunsavage. Doug Dunsavage is going to come back on the other side. We're going to talk a little bit more about the work that he has been doing and we are doing on food insecurity, as well as a little bit more about his career at the American Heart Association. So check us out on the other side. Deconstructing Dallas, Shawn Williams, Ron Trimble. We'll be right back.
From a baby's first steps to walking your daughter down the aisle, so many of life's precious moments are spent on our feet, and every step you take contributes to a healthier heart. By walking briskly for just 30 minutes a day, you can lower your risk for heart disease and stroke. So join us and take the first step to a healthier, longer life. The American Heart Association. Life is why.
Deconstructing Dallas, Shawn Williams, Ryan Trimble. We are back with Doug Dunsavage, North Texas Community Advocacy Director at American Heart Association. And Doug, we talked before the break about the work that we've been doing on food insecurity here in Dallas. I wanted to ask you, from that work that we've been doing, what's been the biggest surprise or the thing that stood out the most as you've worked on food insecurity here?
The need. I think, we did a tour of Southern Dallas, I guess a couple weeks ago, Shawn, and I've lived in Dallas my entire life, off and on, but born and raised here and in East Dallas. And when we went down and did just a driving tour of Southern Dallas, the places that I had seen, you pointed out to me, Southern Dallas itself is twice the size of San Francisco. I think that if you were to tell people that across the board, that it's amazing how vast and how much area that covers. And for us as Dallasites, not to really ensure that all of our Dallas communities are working together to provide basic stuff. Basic services like healthy food access. So you're not, you can walk down the street and get healthy foods and not have to go to a McDonald's or a Wendy's for your meals every day.
One of the things that you introduced me to is the term food swamp.
Yes.
Which I hadn't thought a lot about because, yes, there's food deserts where you have not the access that you would want to, fresh produce and things like that, but also there's a plethora of things you can eat, but they're just not good options.
Right. And, food swamps are areas that have such a concentration of fast food restaurants that they become swamp. I guess that I don't know exactly where the term came from, but there's more availability of fast food than there is fresh food, and it's the easiest option for these communities to get to. If you're a working household and you are driving home from work, or you're taking public transportation home from work, and you are walking home and you have 5 options on the way home, and all of them are fast food restaurants and not corner stores that provide healthy food, or not even a small grocery store that can provide access to healthy food. You don't have time to take public transportation 3 miles after you've worked a 10-hour day and get those healthy foods. So it's a food swamp when there's more fast food restaurants than there are healthy options. So that was extremely surprising to me. And to get to know the geography for the first time as a Dallasite in Southern Dallas, I don't mean to sound so pessimistic, because in my view, I think it gives us great opportunity to make more folks aware of that this is a problem that's out there in food insecurities and in active living, but also sort of those social determinants that we really need to work on. Outside of CVD and stroke, I mean, it's made us realize at the Heart Association that we can't just go in and focus on cardiovascular disease and stroke, but we have to look at housing, and we have to look at poverty, we have to look at literacy, we have to look at so that people can read the prescriptions on their drug bottles. So it's really basic stuff that I think there's a wealth of opportunity, if you will, to affect change in Southern Dallas. So the problems are there, but I think that, and maybe I'm looking at it as half full, the glass half full, but I really believe that we have a blank slate in terms of the ability to really invest in the community and work with our community partners that are already doing great work, and to go in the same direction from a collective impact perspective.
And I guess that was probably my biggest surprise in looking at how American Heart Association views the way that they can impact this area, is looking just past, as you say, screenings and impact in that way, but also looking at poverty, looking at crime reduction, looking at literacy, looking at all the holistic education, all the holistic things that help with quality of life. And for those who aren't familiar with the collective impact model, it is bringing people from all those areas of expertise to the table in order that we all, because traditionally, in the work that I've done for sure, and I want to talk a little bit more about the work you've done over your career, but people kind of do their thing and you get credit for it, and you, like you said, you kind of move to the next thing. But now, based on how you guys are looking at all of the facets that will impact this one patient or this one neighborhood, I think that's probably been a pleasant surprise for me.
Absolutely, and we've realized that we have to make this shift if we're really going to affect the health of all people in communities, which is our mission statement, so that they can live healthier lives. We have to look at the entire system. And so it has to be a systematic approach. It can't be just the Heart Association. It has to be a plethora of groups that are coming together, working on either policy or community programs, whatever it takes to sort of move the needle from a systematic approach. Is how we're really going to affect change. Again, though, policy is a big part of it. I mean, ultimately, we have to bring all those people to the table to understand that enacting formal policy in these areas is a big component of that. But it's one component. It's not addressing the entire systematic approach.
So, Doug, you've spent 15 years at the American Heart Association, so it'd be great if you could just let us know how you got started, kind of some of the different roles you've had with the organization that's brought you back to Texas. Right.
So I've been in the political field, I guess, for over 20 years, and I worked in Dallas and then down in Austin. And my wife thought it was a good idea if we lived in the same city, so we dated long distance for 3 years, and I came back in 2003, I guess, to Dallas, and started with the Heart Association in May of 2004, and started out as an advocacy director that basically covered North Texas, and I covered the delegation of state reps and state senators in the North Texas delegation, and then became government relations director statewide, and worked our issues in Texas. And then I did a 6-state region, which I became director of policy campaigns, so all of our campaigns that we worked on the state level. And then in my most recent role, I was at the National Center, where I was a state advocacy consultant. And I worked on systems of care, which is all the hospital systems, from when an acute event happens, a heart attack or stroke happens, from when EMS picks you up to when you're discharged from the hospital. So we worked on policies in that area, and we had a lot of success around the country. And then I also worked on acute cardiovascular care, so emergency cardiac care. We've gotten 38 states to require CPR training for all children prior to graduation, which I'm really proud of. But in the meantime, I also worked a little bit on community. One of my greatest, or one of the things that I've really, really enjoyed